postpartum period is so exciting and special, but also comes with many challenges. In this TED Talk, we'll discuss the transitions that occur during the fourth trimester, providing both a clinical understanding and halachic guidance. My name is Sarah Cheses, and as a Yoetza Halacha, I will be providing the halachic guidance for this time period.
My name is Batsheva Bane. I'm a certified nurse midwife and lactation counselor practicing in North Jersey. Childbirth is a transformative and momentous time, but today we are going to talk about the often overlooked postpartum period. It can be surprisingly difficult. Having some understanding about the changes that will occur or some difficulties that are commonly experienced may be helpful in successfully navigating through this period. In this TED Talk, our focus is a postpartum period specifically related to Jewish laws of family purity. I will try to provide a snapshot of some of the underlying physiology and clinical considerations that have impact on Taharat HaMishpacha. The mode of delivery, for example, C-section or vaginal delivery, will have implications on one's recovery. If one births vaginally, a few things can happen. There might be a perineal or vaginal tear or laceration, an episiotomy, which would be if your provider had to cut to widen the perineal space, or an operative delivery with a vacuum or forceps. If there is an extensive laceration or any of these other complications, the recovery can, in general, be more uncomfortable or painful, specifically in the immediate postpartum period and during any physical contact when in the healing stages. Post-delivery bleeding is called lochia. It starts similar to a heavy period and will taper to a brownish and then to a yellow-white discharge. There's a large variation in how long it actually lasts, with a range of about 3 to 8 weeks. And although it may generally taper down, spotting or start and stop bleeding can be normal. If the lochia has a distinct offensive odor, if the bleeding doesn't taper more generally or over time, or if one starts to pass clots once they've left the hospital, one should contact their OBGYN provider. Other changes to mention include hormone changes. Hormone levels swing wildly during the immediate postpartum period, which is presumed to be one of the major contributing causes of postpartum depression. If breastfeeding, estrogen levels will be persistently lower, causing a delay in ovulation, as well as vaginal atrophy, or vaginal tissue that is thinner, paler, with less lubrication. At your postpartum visit, your doctor should check any stitches, vaginal tissue, and tone, as well as do a general health assessment. To start our conversation on mikvah and resuming intimacy, there is no evidence-based reason to wait to resume penetrative vaginal intercourse until week 6 postpartum. If there is a laceration, the tissue may take a while to return to pre-laceration strength. But again, it depends on the extent of the injury and the type of suture used. Actual suture material is most often dissolvable. Proper healing of the tissue often requires rest and minimal disruptions in the form of bdikot or penetrative intercourse. But to note, there's no abrupt or distinct change that occurs at 6 weeks postpartum or at the postpartum visit that would allow for resumption of sexual activity.
On the halachic side, you can go to the mikvah as soon as your bleeding has stopped. And again, as Batsheva said, this will range in time from woman to woman. It's not uncommon to have that stop and starting again, so don't get discouraged. And also you should know that you can count the 7 clean days, even if you have some spotting, as long as that spotting doesn't cause you to be nida. So you can review the laws of staining to understand which kinds of spotting would interrupt the 7 clean days and which kinds wouldn't. When it comes to doing bdikot or the internal checks leading up to the mikvah, it's important to be careful due to the physiological changes to your body, such as the vaginal dryness or fragility, and stitches if you have them. And due to these concerns, the poskim of Nishmat advise not to do the milch dachug at this time. If you're finding the bdikot particularly difficult, you should ask your halachic authority what you can do in order to count the 7 clean days more easily. These might include reducing the number of bdikot, doing 1 per day instead of 2, reducing the days in which you do the bdikot, which the bare minimum would be the hefsek tahara, and then day 1 and day 7, or wetting the cloth with water to make the bdikot more comfortable for you. Just as some women experience discomfort with Badikot, some experience discomfort with intercourse as well. And not all women are ready for vaginal intercourse once they've gone to the mikveh, and that's okay. You don't need to have intercourse to have intimacy, and you should still go to the mikveh as soon as you can to allow other forms of touch that you can enjoy. It's important to communicate with your partner about what each of you are feeling and to make sure that you both feel loved and supported.
Pain with intercourse postpartum is relatively common. Again, this is typically due to the stitches and vaginal atrophy, though some extra lubrication and or various positions may ameliorate some of this discomfort. If the discomfort is persistent, contact your provider and schedule a physical exam. It can be helpful, and your provider should be able to provide some helpful guidance as well as potential treatment. Now let's talk about birth control. Birth control is divided into three main categories: non-hormonal methods, combined hormonal methods, which are methods that include estrogen and progesterone. And the third category is progesterone-only methods. Estrogen increases one's clotting risk, and there's already increased clotting factors postpartum until 8 to 12 weeks. Estrogen may also affect one's milk supply, especially in the beginning when the supply is just being established. This is why the combined pill or the regular birth control pill is not used in the first 3 months. Breastfeeding, if used specifically as a method to prevent pregnancy, is called lactational amenorrhea method. It can be up to 98% effective in pregnancy prevention, presuming that the baby is still under 6 months old, fed on demand exclusively or mostly exclusively, and the patient has not yet experienced a period, though one may ovulate before they experience their first period postpartum. Progesterone-only options include the mini pill, the Nexplanon, which is a device placed in the arm, and the progesterone IUD. A common side effect of progesterone-only methods, specifically related to our conversation, is the initial spotting. One can spot for about 2 to 3 months from initiation, depending on the kind of method. But after this initial period, cycles may be lighter, or one may have no cycle at all.
On the halachic side, since the IUD and progesterone-only pills can cause spotting, we recommend that you should begin these forms of contraception after using the mikveh postpartum. It's also important to review the laws of staining to make sure that you don't become nida unnecessarily due to the spotting that you may experience. For women who are breastfeeding, questions sometimes arise about the permissibility of pumping milk on Shabbat. So generally, pumping is not permitted on Shabbat. However, it is permitted in certain circumstances based on the needs of the baby, which are unique to each situation. So to determine the right course of action for each person, it requires a conversation with the pediatrician, often a lactation consultant, and your halachic authority. Many women think that when it is permitted, it's best to use a manual pump, but actually it's preferred to use an electric pump that's set to go on a timer.
We can't finish this talk without mentioning postpartum depression, which is the most common complication of childbirth. It is thought to be caused by the hormone changes, as mentioned, in combination with the stressors like lack of sleep and all our family obligations, and a genetic predisposition to depression. Of clinical importance is if the mood changes are affecting one's functioning and lasting longer than 1 to 2 weeks. Another illness to mention is postpartum psychosis with delusions and hallucinations. And if anyone is experiencing that, that would be a reason to seek immediate medical attention. With the right support and some self-care, taking time to really understand what is happening with our bodies, the transitions can be navigated smoothly, and this period can be affirmative and positive for both ourselves and our families. Any questions, feel free to reach out to both Sarah and myself through Nishmat.
Thank you.